Why is your Lyme treatment failing? It's not the bug. I mean, you've taken doxycycline, you've done herbs, you may have even done some oxidative medicine or hyperbaric. But 6 months later, you still have the brain fog, the joint pain, and the fatigue, and you feel like you're failing the treatment. But you're not failing. I would say that the diagnosis is incomplete. And in my clinic, when I see a Lyme patient who's not getting better, 9 out of 10 times, they have an invisible anchor holding their immune system down. It's a barrier to healing, and it's not the Borrelia burgdorferi bacteria. It's usually environmental toxins, heavy metals, and the worst one of all, mycotoxins. That's mold. Killing the bug doesn't matter if the house or the body's rotting. And mold releases these fungal toxins called mycotoxins that actively suppress your natural killer cells. So here's the pathway. If you've had mold in your system, your immune system's blindfolded. You can throw all the antibiotics you want at Lyme, but your immune system cannot see the target to finish the job. So how do you know if this is you? Here's the difference. Lyme pain is usually migratory. It moves from your knee or to your shoulder, to your hip. The mold pain is usually a static shock, ice pick pain, or respiratory issues coupled with extreme neurologic brain fog. Standard lab tests miss this. Now, in my clinic, we look at live blood. When we look at patients' blood under a microscope, you can see the different phases of Lyme disease, but you can also see mold characteristics. I don't just see spirochetes. I see dirty blood. You have fungal markers, you have uric acid crystals. We may even have parasites. We have crinkled edges of the cells that can indicate that your drainage pathways are clogged. Remember the neural therapy that I talk about? That's how we can literally reboot your nervous system. We get the nerves to open, hyperpolarize, depolarize, repolarize. So open, close, and reset. So if your autonomic nervous system is trying to detox mold, but your liver and your kidney nerve pathways are blocked by trauma or what we call interference fields, it's my experience that people just reabsorb the toxins. So we use neural therapy to open the drain or reset the nerve, and then we use binders to pull the mold out. You can't fix this with just a pill. You need a structure, the chemistry, the whole body approach, and importantly, you need the biochemistry, the biomechanics, and the energy working together. You see, here's the hard truth. You cannot get well in an environment that made you sick. You need to test the body with urine mycotoxin tests. We can literally send this to your house. We can do ERMI testing that is not just air samples. And I've had patients live in trailers, in tents, or move houses, and all of a sudden, their Lyme treatments start working. You see, you have to remove the anchor. If you're the patient who has tried everything and failed, we need to check the mold levels, the environmental, and the fungal load. If this resonates with you, go to lymefighter.com. We have a link right here in the description. We can ship you the mycotoxin and the environmental lab test directly to your house. And it lets us find out, is it something that's in your environment, a herbicide, a pesticide, a cleaner, or is it a mold? And is that the reason why you're not healing? Now, if you're ready to stop guessing and start fighting BAP, I've mapped out the exact blueprint you need. I put it together in the Lyme Fighter Guide. It walks you through different protocols, some ideas about nutrition, and the strategies that you should know about that we offer here in the clinic, but there's other places that we could help you across the street or across the country to get results when nothing else works. You don't have to do this alone. Go to americashealer.com right now. You can literally get information to get started. And our free guide, I'm sorry to give you 2 action steps, is at lymefighter.com. And then that gives you the guide of what I've been working with for Lyme for 26 years. Let's get started rebuilding your health today. They told you it's chronic. They told you to just live with it. I say failure is not an option. I'm Dr. Jason West. At West Clinic, we don't just treat the label, we hunt down the root cause. We combine 100 years of healing history with cutting-edge technology to pick up where traditional medicine left off. It's time to stop just surviving and finally start thriving. West is where health is won. Visit westcliniconline.com today.